Now, we've just been talking about symptoms, and as you recall, we can't look at an athlete and see if he has symptoms. That athlete has to tell us what they're feeling. Well, let's talk about some things that help us that we can actually see, and we call those signs. So we can look at the athlete and tell if he's not acting right or if he's having signs of a concussion. Let's see what those are. So the signs of a concussion include they may appear dazed or stunned at the time of the injury, kind of like the deer in the headlights. They're confused about their assignment. They may forget sports plays. We ask them questions when we think that they may have a concussion, and they may be unsure of some of the answers. For example, we ask them, what game are you playing? Who is your opponent? What is the score? They may not be able to answer those questions. They may move clumsily, and that's obvious when you look at them trying to come off of the field, for example. They may answer questions slowly. If they lose consciousness, even briefly, that's a sign that a concussion has occurred. They may show personality or behavioral changes. You've seen the commercial on television where the athlete that's had a concussion is running back and forth behind the bench saying, "I'm Batman." So they may exhibit personality changes that are very unusual for them. If they can't recall the events prior to the hit or the fall, which is what we call retrograde amnesia, or they can't recall the events after the hit or fall, what we call antegrade amnesia, then we know that they've had a concussion. Now, sometimes an athlete who finishes a game can be diagnosed with a concussion. For example, sometimes an athlete will have a concussion, he'll continue to play the game if it's not recognized, but he won't even remember that he played the game. So if someone is talking to him then, they can make the diagnosis even after the game is over. Some athletes may not report symptoms until after the contest. They want to continue to play. Then after the contest, they'll say to the trainer, "Oh, in the second quarter, I really got hit in the head and I've had a headache the whole time." These are the things we want to educate the athlete about so that he is reporting them in a timely manner. So what do we do if we're at a game and we suspect somebody of having a concussion? Well, say the player's down on the field and the trainer rushes out or the parents rush out to see it. We want to basically look at him, see if he's awake, make sure that he's coherent, keep him on the ground to make sure he doesn't have a broken leg or other type of injuries. It's very important to ask the player what happened. If he can't tell you what happened, then that's amnesia and he's had a concussion. You want to check what we call the mental status. In other words, is he awake? Can he answer some simple questions for you? We want to check what we call the motor exam. That means, are they moving their upper and their lower extremities normally? Sometimes the player may be down because he's broken his neck and he can't get up, he can't move his extremities. That would be one time when we would want to keep them down until we had the medics come out and take them off on a backboard. And the last thing we want to do is determine how they can best go to the sidelines in a safe manner. Whether we can get them up and walk them over to the sidelines or whether we have to carry them off on a stretcher. So how do we know about recognition and treatment? Well, we've talked about signs and symptoms. The next thing we want to do, if we think they've had a concussion or if we know they have a concussion, is to remove them from the game or practice, and they cannot return that day. When would we do more? When would we send them to the emergency room? Well, if they have a loss of consciousness, if they have progressive symptoms, say they have a headache after they've had their concussion, they come to the sidelines, but as time progresses, their headache gets worse and they start having nausea or vomiting, they need to go to the emergency room. If they have a seizure, and you want to take them if you're worried about them. They're not recovering, you're just worried that something else is going on, then they need to go to the emergency room. It's better to be safe than sorry. If they're seen in the emergency room, they'll often get a CT scan. Remember, we talked about concussion being a functional injury, and usually a CT scan or an MRI scan is normal. However, one of the reasons we're sending them to the emergency room is to make sure there isn't something else going on other than just a concussion. Well, what's the treatment? Well, when we diagnose a concussion, we want to remove them from practice or game and do not allow them to return. And they must be seen by a healthcare provider trained to treat head injuries. That's now part of the law. So we make the diagnosis by symptoms and signs and by our neurological examination. We now add what we call a neurocognitive test, which helps us to make the diagnosis more fully and also helps us to know when the brain is recovering. So what's the game day challenge or the practice challenge? Well, it's recognizing that a concussion has occurred. We've talked about a multiplicity of signs and symptoms. Can we believe the athlete who says he, she is okay? Will athletes now really hide their symptoms? Because if they admit to the symptoms, they're out of the game or they're out of practice and may not be able to return. Well, when we have them on the sidelines or on the side of the court, we just keep asking them questions and observing their behavior, and it will usually become obvious that they've had a concussion. Let's talk a little bit about neurocognitive testing. In the past, we've made the diagnosis of a concussion just on signs and symptoms, and then we just had an arbitrary time of keeping them out of play. We really didn't have any science for that. Over the last 10 years, neurocognitive testing has been developed, and in Indiana, most of the state uses what we call impact testing, and impact stands for Immediate Post-Concussion Assessment and Cognitive Testing. The impact test helps us to diagnose a concussion and determine when the brain has healed. The player's symptoms and signs may be gone, but the impact may remain abnormal, indicating that the brain has not healed. Baseline testing should be done on all athletes because we want to compare their test after the concussion to themselves, and that would be their baseline test. Now, you don't have to have a baseline test. If for some reason you've not had a baseline test, we still want you to have a post-concussion test, and we can compare it to normal values. We do the post-concussion impact several times often until it comes back to the baseline. So let's talk a little bit more about the impact test. It is a computerized cognitive test that was designed for sports concussions only. It does not reveal your IQ. It does not reveal psychological problems, but it can sometimes help reveal learning disabilities. Well, let's talk a little bit about what the athlete goes through when he's taking the test. First of all, the 22 symptoms that we talked about are listed here, and the athlete will have to address each symptom and say if he's having the symptom or not, and also then he has to rate it from minor to severe, from a 1 to a 6. The test is made up of 6 modules. The first module is what we call word discrimination, and there will be 12 words that come across the screen, one at a time. It'll do this on 2 occasions. And then this question will come up. Was small one of the words displayed? Now they try to fool the athlete a little bit because The real word might have been tiny and they're using small. It has to be the exact word. Or it could be ice and snow. The second module is what we call design memory. So they'll see a design similar to this one, and then 11 more designs. They'll come up and be on the screen for a short period of time, and they'll do that 2 times. And then they'll display a design and ask if it was one of the designs displayed. Now they also try to fool the athlete a little bit. They may turn this backwards for forwards or upside down. It has to be exactly what it was at the beginning of the test. The third module is what we call X's and O's. So you'll have random X's and O's covering the screen of the computer, but 3 of them will be highlighted. That'll go away for a short period of time, and then this test will come up where you have a red circle or a blue square, and the instructions will tell you whether to hit a certain key for the red circle and a certain key for the blue square, or left mouse or right mouse. You're able to practice this for a short period of time, and then this is what we call a speed test or reaction time test. Then you will press the appropriate key when the red circle or the blue square comes up as quickly as you can. You'll do that for a few seconds, and then the random X's and O's will come over the screen again, and you'll have to highlight the 3 that were highlighted before. And this will happen on 4 occasions. Module 4 is what we call symbol matching. So you have 9 numbered boxes, and above each number you have a symbol. Then at the bottom of the screen it'll show one of those symbols. The athlete must point to that symbol in the box as quickly as they can. They'll do this for a period of time, and then all of the symbols will disappear. The numbers will remain. They'll be showing a symbol, and they'll have to point to the box by memory that the symbol belongs in. This is a speed test as well. Module 5 is what we call color match. So as you can see here, they may have a red rectangle with the word red printed in red, same way with green and blue. That would be a complete match. So if they had a rectangle that is blue and you have the word red printed in blue, that would obviously be wrong. This is also a speed test, so they work as quickly as they can. And the last module is what we call 3 letters. So 3 boxes will show up on the screen with a consonant in each one of the boxes. That'll be up for a short period of time, and then this display of the numbers 1 through 25 in a random fashion will appear, and the athlete will have to count backwards, finding the next number, as quickly as he can. You'll have 18 seconds to do that. And then the 3 boxes will reappear empty, and the athlete will have to type in the consonant that was there before. And there's 5 trials of this test. As soon as they finish the test, then online we can get the results of the test. And this would just be an example of a baseline test that gives us certain values for that particular test. And then if they have a concussion, we can compare the values after the concussion to the baseline. We'll continue to do that until they get back to normal.